Hi, my name is Aaliyah Dudash, and I am an occupational therapy student. Today I'm going to talk about my health policy analysis of the bill known as S.1725. This bill is also known as the Medicare Home Health Flexibility Act of 2019. This focuses on Medicare insurance policy. So the eligibility requirements of this is if you are over 65, collecting Social Security benefits, diagnosed with ALS or kidney disease, and this affects you if you have any friends or family who have these requirements and are enrolled in Medicare insurance care. Also, if you eventually are able to be eligible for this, it's important to make sure that new policies that promote health promotion and the overall beneficence of our clients and yourself in the future. So the home health rehabilitation team consists of the physical therapists, occupational therapists, and speech therapists. So currently in this setting, speech and physical therapists can conduct comprehensive and initial assessment for the clients. However, occupational therapists can only conduct these assessments under specific regulations. These regulations include whether there is skilled nursing already involved in the client's care within the home, or if the previous occupational therapist who was working with the client has recommended that an home health OT comes in and does an assessment. Now, this is important because this bill will reform the policy to make the occupational therapists at the same level as the physical and speech therapists because they are qualified and competent to do so based on their clinical reasoning and certification. I want to point out the impact of occupational therapy that the bill S.1725 would enact on clients involved in Medicare. So the fall-related injuries, otherwise known as FRI, is the most common diagnosis for hospital readmission. OT can decrease this by using a preventative approach to decrease the fall risk of the clients at home. This is done using a holistic approach, otherwise known as using a PEO model when they're within the home setting, which focuses on the person, the environment, and the occupation. So the image on the right depicts the actual client in the middle, and the outside surrounding is the contributions to the client, their occupations, and their environment. For example, you have the home, which represents the physical attributes of their environment. Also the globe, which is their culture, their hobbies, their durable medical equipment, functional mobility, their supports at home, and also community involvement. Now, this is specific to OT because we are client-centered and we focus on a top-down approach, so the client before the diagnosis. So what can you do to help promote this bill? It's important that we advocate. This includes spreading awareness, whether this be through social media or physical communication between the therapist, the client, to the other interdisciplinary team members. Also, you can make petitions to spread online. Secondly, call your legislators. Explain your concerns to them. Make them aware that this is a problem. Ask questions so they themselves question their motives and how important it is to change the current policies. And if you can't speak directly to them, email, send letters. If they don't answer, keep sending letters. It's important to make them aware and acknowledge that OT is a competent occupation within the home health setting. This is my references that I used for this presentation, and I also provided my slide format and my icon references.